Hi, folks. Dr. Byer. Today we're going to talk about autoimmune disease. Autoimmune disease means that your immune system is mistakenly attacking your own tissue, and depending on the tissue site will dictate the name of the disease. Now, the traditional medicine approach to most autoimmune diseases is just to kind of squash the whole immune system with corticosteroids or different immunosuppressants. Whereas, from a functional medicine point of view, we're interested in what's driving or what's triggering the immune system to do that. Today, I want to talk about probably the biggest trigger to autoimmune disease, and that's the foods that we eat. Folks, the food that we eat today is very different than the food that we ate 20, 30, 40 years ago. A lot of it's been genetically modified and it's been altered to the degree that our own immune system and our gastrointestinal system is reacting to many of these foods. So when a patient comes to me with an autoimmune disease, we're going to be running a food sensitivity test on that patient, and we're going to be able to identify the exact foods they need to eliminate from the diet. That's absolutely crucial. Nothing's going to happen unless you do that first. There are many different tests out there for food sensitivities. Most of them aren't very good. You need to make sure that the lab that you use is measuring both antibodies called IgG and IgA, and it needs to be done through serum, through blood. So we use Cyrix Labs. You can go to it at cyrixlabs.com. They're in Phoenix, Arizona. It's a simple blood draw we do in our clinic, and then we send the blood to the lab, and then within a few weeks we know exactly the foods that our patients are supposed to eliminate from the diet. So all of these things that we know that can trigger an autoimmune disease, there's many different science, or there's a lot of scientific literature backing up what we do and how we can really change the person with an autoimmune disease, how we can change their life. But it really begins with food. I'm Dr. Ed Byer. I hope that helps. Have a great day.